It's my pleasure to introduce to you two individuals who are going to be speaking to you now. Paul Aurand is a hypnotherapist. He's an incredible guy who we had speak for us last year at the IANDS conference. And he and I talked about perhaps he would come back and do something else in the future. And the person who's going to be speaking with him is Dr. Atilio Costa Vitali. Now, the way I know about this is Paul called me one day and said, okay, I want you to know there's a cardiologist and a psychiatrist, and we're all three working together in situations where a post-MI patients, of course, we're talking about this totally medically, but what he was saying is people who had had heart attacks, MIs, that they were looking at those patients post-resuscitation, post-comeback, and everything's fine, and looking at kind of after effects, what was reported to them and so on. And it was sounding to me like, oh my gosh, things as an ICU nurse that everybody needed to know about and so on. So I'm salivating talking to Paul on the phone. And I said, oh my God, Paul, this sounds like something we need to have at the conference. He said, you're really thinking so? And I said, I'm knowing so. And it needs to be a plenary session. And so as we put this conference together, this was supposed to be the only thing going on at this time because we feel like it's going to be such a precious moment for us to learn all this. And so I'm happy to tell you that it's happening. We have two other things going on at the same time because of lack of time. So without any further ado, I want to introduce to you now these two gentlemen who are going to help us understand some things they've learned from patients who have had heart attacks and come back to talk about it. So, yes.
Good luck.
Thank you. Okay, well, Atilio Costa Vitali, I'm a cardiologist, and I am an electrophysiologist. So basically what I do is I deal with patients who have sudden cardiac death. And what we normally do in those patients to prevent a second event is we put special devices. They are called implantable cardiac defibrillator. And what they do is they shock the patient's heart to bring them back, okay? It's like they had a paramedic living inside them 24/7. So a friend of mine who is also a professor at the University of Lisbon, he's a psychiatrist, and he is very much interested in spirituality. So one day we were having dinner and we knew Paul from before and said, why don't we do something about sudden cardiac death patients? You know, I see them, you know, on a daily basis. I see over 45 patients with sudden cardiac death in my hospital. So, and I did not know about these near-death experiences. I didn't know if they had or not a near-death experience or not. So, so when we were thinking of what to do, well, we did a lot of literature research to find out what to do in regards to near-death experience. And there was a lot of things written about people who they did recall they had an experience and they knew, they felt it, they really had in their mind all the experience. But what happened with those patients with maybe the majority of my patients, the ones that I see on a daily basis, who they had a sudden cardiac death, but when they came back, they don't remember anything at all. So what happened to those patients? Did they have a near-death experience or they didn't? So I talked to a few researchers, one of them, Dr. Van Lommel, and he told me, well, most likely these patients did not have a near-death experience. They just, it was too short. They were dead for, I don't know, 5-10 minutes, and they just didn't have an experience. And I didn't quite buy that. So, and I said, you know, what's so special? Some people have experience, some people don't have experience. So I said, you know, well, my hypothesis will be that everybody who died will have a near-death experience. And I was thinking what to do, how to, you know, recall those memories if these patients had a near-death experience, they just didn't remember it. So, and doing research, I found out that maybe hypnosis is a very good tool, and that's where Paul came. So basically what we decided to do is to analyze the characteristics of the memory. So we had two groups. One group we call it the NDE group, and the other group we call it the control group, okay? Because we had something that we had to control with to see if those memories were real or not. So So in the NDE group, so the patient would come to see us, then we would ask the patient to tell us exactly what happened, okay? And most of them, or the majority of them, they stop at the very minute when their heart stopped. So they had zero memory of what happened afterwards. Then they woke up in an intensive care unit bed. So that was one of our inclusion criteria. The patient didn't have to have any memories at all of what happened. So then after hypnotherapy, well, Paul will show you some videos where those memories resurfaced. And we compare those memories, okay? So we used two scales, basically. We used one, first of all, I think this is very important. All the patients that were included in this research, none of them had a psychiatric illness, okay? And that was very, very important because we didn't want to have any bias in our research. So it was an exclusion criteria to have had any psychiatric problem within the last 6 months or the previous 6 months. So what we did is we analyzed the characteristic of those memories, okay? And we used the modified version of the memory characteristic questionnaire, which is something that was created by D'Argenbault and van der Linden, and which analyzes basically different aspects of the memories. Okay, analyzes the sensory aspect of the memory, the clarity of the memory, if it's clear or not, the self-referential information, emotionality, reactivation, and confidence. So there are different aspects of memories, and we compare them both. So this is what we found. I'm going to explain to you what that is. Unfortunately, it's not very clear, but this is what we found in both groups. So patients who had sudden cardiac death, the memories that were retrieved by hypnotherapy, interestingly, had much more characteristics than the real memories. Okay, so what I mentioned to you before is that we had a control group. So that control group were patients who Paul, he did a hypnotherapy sessions with them, and we didn't know exactly which memory to use. I was thinking a wedding day. But there was some debate going on, and then we decided that we were going to compare that to a real memory, the first time they drove a car. Okay. So compared to that memory, the first time they drove a car, and the memories that were retrieved by hypnotherapy, those memories had much more characteristics, okay? So that's the first thing we found. The other thing we found is that NDEs, or the people who recall that experiences, near-death experiences, they had, those experiences were of extremely high emotional content, okay? Well, we were not surprised to find that because, of course, it's, to die and come back, I'm sure it's more exciting than to drive a car. So the other thing we found, and it is, I think, something very important, is that the NDE group, there was absolutely no significant difference from a statistical point of view comparing the NDE memories characteristics and the memories of the real event when they drove their first car, which tells us that those memories retrieved by hypnotherapy have the same characteristics, which tell us that those memories are true, okay? And the other thing that we found is that hypnotherapy, okay, and this is something that I'm happy that we found, is that hypnotherapy is a very efficacious way to retrieve memories of patients who had died, if you wanted to explore further into the near-death experience. So in NDE, I don't know if there is any other tool out there, but I think that hypnotherapy is a very valid tool to retrieve those memories. And the thing that we are going to work on eventually in the next part of this research is to use some of the information that these patients recall with healing purposes, okay? Because I think that that's the most important part of this. We have, it was a learning lesson for me, after we did this research, talking to all these patients of their experiences, how it changed their life in many ways. Because one of the aspects of this research was to see if by recalling those memories, their life would change. Okay, so basically we did a questionnaire. It's called the Minnesota Living with Heart Failure Questionnaire, which is a questionnaire that we use in clinical practice to see what's the quality of life that these patients have. So we use that questionnaire at the moment of the randomization where the patient was included in the research, and then 1 month later. So there was absolutely no difference. I didn't see any difference. So there's something that we need to look into, because the patients are telling me that there was a difference in their quality of life, although it was not reflected in that questionnaire. Maybe we're not using the right questionnaire, I'm not sure. But it did, those memories really had a lot of healing power, and that's probably something that we need to look into when retrieving these memories, because it's good to retrieve those memories and to prove that hypnotherapy is a very good tool to retrieve those memories, but what are we doing with that? And that's what we need to look into probably now in the second part of the research. So, and Paul has more exciting videos to show you. Want to come here? Yeah. Okay, I don't know how to do that. What do you know how to do? No?
Let's see.
Yeah, okay, I'm going to sit.
So I think I had the really fun part of the job, which was regressing these people back to a few moments before their hearts stopped. I was here last year and talked about my own near-death experience 21 years ago when I was struck by lightning. Sat in a talk this morning about 3 different people struck by lightning. I thought that was a bit odd and a bit, triggering. But I really appreciate Atilio for being brave enough in the medical world to round up these patients that we could work with. So I do have video clips for you of 4 different people that we worked with. We worked with 20. I'd love to show you all videos, but I guess that would take a couple of days. I love watching them because I learn something every time I see them. This first patient is a minor that I've regressed back to just before his heart stops. He's working on a really hot piece of equipment on a really hot day and collapses. And he reports during the regression being unconscious and confused, and then he watches them as they try to resuscitate him from behind the group of people. I think the video says more than I can say about it. We had to pixelate the faces for privacy, so you don't see the facial expression. I'm sorry about that, because here's this big, tough miner, Canadian, who just cries like a baby as he recounts some of this.
Very hot outside.
So just check with your body and notice how that heat feels. How your body's doing with that heat.
It's very uncomfortable.
In what way is it uncomfortable?
I'm sweaty. It's making my head tight.
Sweaty and your head is tight. And moving forward then, what is it that happens next?
I feel nauseous.
Nauseous. And where are you when you're feeling nauseous? Head tight, sweaty.
Behind the converter I was working on.
Behind a converter that you're working on. Okay. Taking a breath, going deeper. Moving forward slowly. What is it that happens next?
I look at my feet, not feeling well. Somebody says, "Are you okay?"
You look at your feet, you're not feeling well.
Feel myself drop.
Oh, you feel yourself drop. And then what happens?
People around.
You drop, there are people around.
Can't understand what they're talking about.
Why is that?
Unconscious.
You're unconscious and you can't understand what they're talking about, but
I'm confused on what's happening.
confused. And then what happens?
There's men there I don't recognize.
The men you don't recognize, and what are they doing?
Working on me.
And tell me, as they work on you, where are you in relation to your body that they're working on?
Observing from behind.
From behind, you're observing. Then what are your thoughts and feelings watching them work on you?
Scared.
And what is it that they're doing?
CPR.
And then what happens? You're observing from behind.
Somebody picks me up.
They pick your body up.
Takes me downstairs.
And do you stay behind or do you follow?
I follow.
How do you do that?
I'm like in a floaty feeling. I'm just kind of drifting behind them.
Drifting behind, kind of floaty.
I see myself go on a stretcher.
And they put you on a stretcher. Yes.
I'm shocked again.
Shocked. Yeah. And what is it?
I'm in an ambulance.
So do you follow the ambulance or do you go with inside?
I'm with them, it seems. Like it's a slow ride.
So where are you in relation to the body on the stretcher?
I'm standing around, overlooking.
And again, what are you thinking or feeling as they're going?
Wake up.
Wake up.
I don't want to do this.
What don't you want to do?
Die.
Don't want to die. You're saying wake up.
I have a wife and kids I love.
Yeah.
Wow. Right? It's not often you get to sort of peek into an NDE like this. So one of the things that we did with the study was we wanted to look at some of the common features, some of the same kinds of things that people experienced while they were in this dead time. And we heard all of them talk about being out of body, watching the scene, either from behind it or above it. They can tell a lot of details about the procedures that are being done on them. Guys that have no medical knowledge describe very well how paddles are prepared. I didn't know. In the movies, it's always like this, right? No, one's on the side. So people describe this as well. They actually describe the conversations that some of the paramedics had in the ambulance. In one of the cases, the two guys were talking about going for a beer after they got her to the hospital. And while they were talking, he didn't have the mask on very well, and she wasn't getting enough air, and was trying to tap him on the shoulder to get his attention. So they know. She even talked about, she was in coma, as is often the case with someone that's had cardiac arrest after treatment. So they can be on a respirator. And she said, well, they think I'm in coma, but I can hear everything they're saying. So they're listening. If you're in that field, they're listening. He also talked about time slowing down in this case. Yeah, we had quite a few who talked about being in the operating room while they're being worked on, while they're unconscious, while their heart's not going. They tend to drift down the hallway to visit the waiting room to try to make contact with or visit loved ones. I've had people describe furniture in rooms they were never in before very, very accurately, as well as the thoughts of the people that were in the room. The next one is an actress that some years prior to her cardiac arrest had an aggressive bacterial infection and her left arm and upper body had been amputated. And she suffered daily with phantom pain until this NDE regression. She's driving to a rehearsal. She's really been pushing for days. She's exhausted and has a cardiac arrest while she's driving and crashes the car. Not very badly, but this scene that we open up on, she's talking about floating next to her body and shocked to see that she has her missing arm.
You feel just very disembodied, like my ghost arm is huge. My hands are huge. Disproportionate.
Yes. And what are your thoughts or feelings about what's happening?
It's uncomfortable. It was very sad. I haven't felt this before.
What's that?
Like my left side, my upper left side, which is, it's a sphere, it's so big. I can't, it's, I don't feel connected
To
my body.
yeah, well, I guess you're not right now. And are you to the left of it or to the right of it?
Left. I'm all on the left. It's all. It's the biggest blobby, sunny sphere. And I can't feel my ghost arm has become swollen. Like I can't. Usually I can move. I have the capacity to move it around. In my mind, it actually helps relieve pain. But right now it's in a. It's become distorted and huge. Globular, big.
And would I be right in understanding that it's free of discomfort?
It's free of discomfort.
Yeah.
It's a foreign feeling.
I understand, yeah. Give yourself some time with that. There's something significant about that. We'll find out more about.
It's really strange.
Yeah.
It's really, really strange.
Help me understand what's strange about that. To be free of pain there in that ghost arm.
It only happens when I sleep. Every other time it's constant pain. I still feel a big orb,
Yeah.
or like a big
Describe that big orb for me.
it's like this part of my body, but it's not. It's like a field around me, but it's mostly on my left side. And it's like from my waist to the top of my head, out in front, out to my side. But my arm is encased in it, but usually I can feel specifically. My arm, I can't feel my arm specifically. It's like it's like it's become the distended orb blob.
Yes.
So imagine years of pain suddenly gone, other than when she's deep asleep. It led us to wonder really about the spontaneous healing potential of regressing people back to this time in between. We hear stories like Eben Alexander's and Anita Morjani, who had these spontaneous healings while they were out of body. And we wonder if there's some way, perhaps, to access that kind of spontaneous healing through this kind of regression therapy. We've only worked with 20 patients so far, so we don't know, but that's something we'd like to explore in a further study. So again, some of the features, we see her out of body, floating next to the body in the car, for the first time free of pain. And as I said, made us really wonder about healing potential in this kind of work. This next one was a very unusual case. She was an operating room nurse, a real tough cookie that did not leave her body over the entire time, and she was unconscious and having CPR for over an hour. She was on a camping trip in the wilderness with other physicians. That saved her life, I'm sure. Very hot, felt uncomfortable, went up to her tent, has a seizure and collapses. She reports attempting to call people for help, but of course she's unconscious and unable to communicate. But her dog that was with her realizes there's a problem, barks, and gets the attention of some of the other people who come up to see what's happening, find her unconscious, clear the airway, and begin CPR. They get her on a boat. She tells this long story about the hour-long trip in the boat. It was a very small motor. They were going upstream. They couldn't go fast enough. They had to get to a place where they could get a cell phone signal and call for a helicopter or an ambulance. While they're traveling in the boat, she feels her body go limp, and then sees a light coming towards her that's calling her. Now, she feels that if she goes into this light, that's this threshold, the point of no return, and that she'll certainly die. So she's very hesitant about this, but eventually she realizes this light is her deceased father, who's come to tell her, it's not your time, you must go back. And she feels that he helped her start breathing again.
You can feel them bringing the stretcher.
She speaks very softly, so I repeat her words for
light,
you.
is it still there?
It's gone.
Okay. So can we rewind just a little bit back to when that light's there? Okay. And you can communicate with it, or it might communicate with you. What's it want you to know? That it's there. And what is it?
It's warm.
Warm.
I think it's my dad.
Your dad.
My dad died.
He died, and he's there as this light.
But I don't see him, I just feel it.
I understand. You feel him, you sense him. And if you just, in a calm way, just be open to what it is he's communicating to you. Well, I know in the time you were afraid that meant dying, and you weren't ready to do that. And talking with him or being open to what he's saying doesn't mean dying. There may be something important there from him for you that you can retrieve now that you couldn't then because you were afraid. Now that you're here calm and safe, ask him what he wants to show you or tell you. Right? He doesn't want you to go now. Mm-hmm. Yeah. So ask him why he's there, why he's come. To keep you safe. So take that in. He's come to tell you he doesn't want you to come there now, and to keep you safe. And how does he do that? How does he keep you safe?
I started breathing.
You started breathing. Mm.
So the criteria for the study was for me to regress the people back and help them recover memories. There's no protocol for interventions, therapeutic interventions. It's something we need to develop. But this is my first attempt with her at a therapeutic intervention, is that she feels the light there but is afraid and doesn't proceed. So I rewind her, reframe it a bit for her, and encourage her to interact with that light using concept we understand is now time. Because we think in linear terms, but when they're not in body, time isn't so linear. I regress them back. I think there's a possibility of them recovering more memories from what happened, but also to continue that process of interaction with loved ones and other wise beings. So this is my first attempt at that, but we need to develop that. So again, we saw her, in this case, stay in her body. She hears conversations. She can hear things outside the tent, down by the water. She can hear them in the ambulance when they get her, when the ambulance is coming. So many people report this, being able to understand or be aware of, hear things are happening in the distance. She finds that threshold that she doesn't want to go past, sees a light, feels very safe and loved, and then meets a deceased loved one, her father in this case, who comforts her, tells her it's not time, and then she feels helps her start breathing. This goes back to the first patient. He's in the ambulance now, and they're trying to get his heart going again. They defibrillate him a few times, as apparently is often the case. We had one patient who said the 2 EMTs had defibrillated him twice, and both times the heart stopped, and they had a conversation between themselves about whether or not they were going to attempt it a third time. He was a bit upset about this. So he's floating near his body in the ambulance, and things really slow down, almost to a stop here. He sees a light that then he reports as being his grandfather, who tells him it's time to go back. And then he meets a relative that he'd never met in this life. And I'll let him tell that story for you.
Let us rewind a little bit, okay? Let's go back to in the ambulance when you're kind of hovering, standing there. And you said it's going slow. Can you help me understand that?
Feels like time is slow and the vehicle's moving slow.
Mm-hmm.
I know I'm in an ambulance.
Yeah. And you're saying, wake up.
I'm saying I don't hear sirens, and it doesn't feel like we're moving very quickly.
Right. Mm-hmm. And do you stay right there with the body?
Yes.
And are you aware of the presence of anyone else?
I drift asleep.
You drift asleep.
Somebody is telling me to go back to my family.
Someone's telling you to go back to your family? Who's telling you to go back to your family?
It's my grandfather, Arnold.
So tell me about meeting your grandfather and him telling you to go back to your family.
I'm so happy to see him.
How does he appear?
He's younger than when he passed away. He seems at peace.
Younger and at peace?
He keeps telling me to go back to my family.
Go back to your family. How do you feel being there with him?
Very comfortable.
Okay, so just take some time here now to not only remember, but to re-experience this comfortable feeling with your grandfather, Arnold. And there may be something more you're hearing or feeling or experiencing.
Seems like there's more people. I don't know them.
And what are they saying or doing?
They're comforting me.
They're comforting you. So again, just take some time to re-experience this being comforted. You'll find it quite helpful, quite healing in many ways. Just welcome it, take it in.
I'm some way related to them.
You're related to them in some way?
They're family from the past.
Help me understand that family from the past.
One is my mother's mom.
Your mother's mother. Is she someone that you've met before?
No, she committed suicide when my mother was 9 years old.
And is there something that she communicates to you?
She loves me.
You may find there's something more than the words there when she says that she loves you. You may just take in that love.
It's a feeling of being cared for.
Yes.
That there's somebody looking over me.
Being cared for and someone looking over you. So really take time to receive that, to take that in, to know that in the depths of your being.
So it's all I can do at that point to not just break down and cry when this big guy melts and says, feels like I'm being cared for. So I've specialized in life between life regression for many years, and there are many similar kinds of stories that people experience and describe. I know what I experienced in my own NDE, and then regressing people back to their NDEs where they have vague or no memory of them has been really educational, exciting, and heart-opening for me. I think there's great potential in regressing people back to these times. So as we saw with him, other features are time slowing down, almost stopped. I don't think when you're defibrillating someone in an ambulance that you drive 5 miles an hour to the hospital. floating near the scene, seeing the light, meeting loved ones, and feeling so safe, loved, and cared for. Imagine the healing power just in that alone. I mean, how often do we experience this in our daily life? So for this last part, Atilio, would you come on up? I know you're comfortable there, but... Is it possible to put the lights on? So there are some new understandings we came to doing this work, but we're left with many, many questions too. We hope we can continue with these as well. One of the things we understand from the study is that regression is an effective tool for recovering NDE memories.
Yeah,
right?
It is.
And we need to develop protocols. It's really, there's no roadmap for this. It's really uncharted territory. But we'll develop that and hope to tell you more as we go along. And we really want to explore that healing potential, not just for them to remember what happened, but to be able to access connection with loved ones, wiser beings, guides, and some state that seems to occur for some people for these spontaneous healings. You know, how did Anita Morjani come back cancer-free when she died in the hospital of it? How did Eben come back when his brain was destroyed, right? So is there a way to access whatever it is that's happening there is a question we're left with. And we also wonder why cardiac arrest patients don't seem to go quite as far as many NDEers. We didn't see life review, we didn't see some of the other features that I experienced or that other NDEers experienced, and we're not sure why. We don't know if it's because they were resuscitated quickly, it wasn't important for them, or perhaps we need to regress them again and see if they can recover more. As you saw, approaching these memories can be quite emotional, as Atilio said, and so there were times where as they got close to it, it seemed like they sort of slowed down, maybe there was conscious interference, or kind of the brakes went on a bit. And so it's learning to get them past that, as well as perhaps having them approach it more than one time. I just saw these people once for about an hour, hour and a half. And we also wonder, how many people have NDEs that don't remember? Right? You want to add something?
Here's a question.
Mm-hmm. Yes? We'll take questions in just a moment.
I think that this is a very good, this is my first research in this type of near-death experiences. I own a research company in Canada, and all we do is clinical trials, so the mainstream research. And this was very educational for me because I learned a lot in terms of how to talk to these people. Because sometimes when you're a physician, you're very busy, you see 45 people a day, you only have 5 minutes to talk to them. But I take a bit more time now to talk to the people who had died suddenly, because there's always something you can learn from them when they come back. And many of them, they changed their life and they don't know why. I don't know if they don't know why, or they don't want to share their story. Maybe they just don't want to share it. But it's very educational from a medical point of view. Yeah.
You want to tell them what you told me just before we came up here about grand rounds?
Oh yes. Well, so we're going to present
before you
this.
lose your license.
Yeah. So we're going to present this in our hospital, in my hospital actually. We have medical rounds, grand rounds every week, every Wednesday at 7 a.m. And it's the auditorium's huge, and everybody's a physician there. So we're going to present about this NDE. We'll see how receptive they are. Yeah, it's going to be a bit of a challenge, but we'll see what happens.
Brave of you.
Yeah, we'll see what happens.
So we're open to questions. I think there's a microphone here that they'd like people to come up to, so they can be recorded as well. Mm-hmm. Is it possible for you, or do you need a handheld? No?
So I'll just jump right in with a question. It's kind of a question and an intuition that I had while listening to you. Has anyone researched the connection between the magnetics of memory because memory is sort of magnetic, and the electromagnetic change that happens in the body when you have a heart attack. So maybe the reason these particular patients aren't remembering is because of the nature of the death experience deals with the electrical circuitry of their body and their brain. Are you following my train of thought?
Absolutely.
Okay.
I'm not.
Well, I can answer one part of that. It's really with a question, though. And most of the cardiac arrest patients are on respirators after their heart attack. And the medication they're given does cause amnesia. So we don't think these memories come from the brain, but the brain is the filter. But why are they not remembering is a question. Yeah.
So I was asking, because I still am wondering, why do people remember this, and why do other people do not remember anything at all? So I had a sociologist in my university where I teach telling me that the reason why they don't remember things is because they are socially conditioned not to remember. I don't know.
2 questions. First one's easy. What was your average documented downtime before return of spontaneous circulation in your patient population?
Less than half an hour.
Half an hour?
Less than half
Less
an
than
hour.
half an hour. And did you find that any particular features emerged in the longer resuscitation times among your study population?
What feature, sorry?
Any specific features emerge among the longer cardiac arrest time patients rather than the short ones?
Yeah, well, okay, yeah. So the features were, most of them were ischemic dilated cardiomyopathy patients, so patients who had a coronary artery disease and their heart just was very dilated. So those were the majority of them. We had only 2 patients actually, that nurse that he was talking about that had a normal heart. She did not die, okay, clinically, although they did CPR and everything, but I did a research and a review of all the chart of this person, and there's no documentation that her heart stopped. Okay, but what that tells me that to have an NDE, you don't really need to have died. Okay, you could have near death sort of experience, and then you still have an NDE experience. But the majority of patients were ischemic dilated cardiomyopathy patients.
They were pulseless in the field though, right? So for all intents and purposes,
Yes,
were.
they didn't feel the pulse. I'm sure that's the reason why
Right.
they did CPR, yeah.
Got it. So, Paul, of those with longer
I get the
CPR
tough one?
times, that was your question. For longer CPR times, did you see anything emerge in your hypnosis and regressions with them for longer versus short times?
It didn't seem to correlate. And I think that we think in linear time. We even had one patient that arrived at the hospital for an exam who at the elevator collapsed. So they got to her very quickly, but she went pretty far in the NDE. Yeah. So it was within a minute they had a defibrillator on her. Yeah. Good question.
The doctor just alluded to this because I didn't have a near-death experience. I had a shared death experience where I left my body and went to another realm, heaven, and I would love to be regressed and go back there because it was the best experience of my life. But I'm just curious. I mean, I just feel like this is the new frontier, and I'm just so thrilled to be witness to the beginning of this. So thank you.
Oh, thank you. Thank you. Yeah. Oh. We'll talk to you after they ask us to stop.
Okay.
Okay, we're here.
Basically, you have 3 groups. One group is someone who remembers his NDE and describes it. Then you have a group that you hypnotize and they have recall. And then you have another group that you hypnotize but do not recall. What's the ratio between, roughly speaking?
I think out of respect for the next speaker, we need to stop. But if you can come up here, we'll talk with you about that.
Okay.
Okay? And the others that have questions as well. Thank you very much.
Thank you.